It's back, and for some, this could be a positive development. Senator Elizabeth Warren recently spoke about a proposed $200 monthly increase for all Social Security beneficiaries. She indicated that, if implemented, this raise could be applied to benefit checks immediately, literally right now in 2026. Not next year, not in 6 months, but right now. This isn't just a passing mention either. Warren has repeatedly introduced legislation aimed at this same goal, most notably the Emergency Social Security Inflation Relief Act, which was brought forward multiple times in 2025. She has consistently championed this proposal, signaling that she is serious about it, or at the very least wants the public to believe she is serious. In her remarks, she highlighted the financial pressures faced by seniors and Social Security recipients. People living on fixed monthly benefits are struggling, she said, because the cost of living adjustments, or COLAs, are failing to keep pace with real-world expenses. Purchasing power is eroding, and many beneficiaries are falling behind. For those who have been paying attention to Social Security trends for years, this is hardly surprising. The reality is that Social Security payments have not kept up with inflation, and people have been raising alarms about this for a long time. Nonetheless, it is notable that a prominent lawmaker is publicly acknowledging the problem. Her video was about 7 minutes long, but the segment where she addressed the $200 increase directly was just over a minute and 40 seconds. In it, she focused on the proposal itself, how it would provide immediate relief, why it is necessary, and the impact it could have on beneficiaries. She discussed Medicare, healthcare costs, and other topics, but the core of her message was about Social Security and the need for a meaningful increase in benefits. Social Security benefits have been struggling to keep up with rising costs for years, especially when it comes to healthcare and home care expenses, which seniors disproportionately face. While benefits are adjusted annually to account for inflation, the adjustments lag behind actual price increases. Over the past 15 years, Social Security payments have lost about 20% of their purchasing power. This means that what someone could buy with $100 in benefits 15 years ago now requires $125 to buy the same goods and services. The official cost of living increase for 2026 was announced as approximately 2.8%, which translates to roughly $56 extra per month for most beneficiaries. $56 is barely enough to cover a week of groceries for many, highlighting how insufficient these adjustments are. Half of all American seniors rely on Social Security for half of their income, and for 1 out of every 4 beneficiaries, it is the only source of income. These are not people with substantial pensions or investment portfolios. They are counting on this money to pay for essentials like housing, food, and medication. The need to expand Social Security is clear, and this is exactly what the proposed legislation aims to do. By providing an immediate $200 monthly increase, it would help seniors, veterans, and people with disabilities meet their basic needs. Warren's video also explained why the COLA system is flawed. The cost of living adjustments are based on inflation data from July, August, and September of the previous year, meaning that by the time the increase appears in benefit checks in January, inflation has already eroded purchasing power for months. This lag is significant. Inflation continues throughout the year, yet only a small portion of it is reflected in the adjustment, leaving beneficiaries effectively behind in terms of real purchasing power. The damage is done before the adjustment arrives, which is why a simple COLA is not enough to address the financial challenges people face. When she discussed the 20% loss of purchasing power over the last 15 years, it was not political rhetoric. It is supported by studies conducted by groups like the Senior Citizens League. This decline has real consequences for millions of Americans. If someone had $100 in benefits 15 years ago, that $100 is effectively only worth $80 today. Rent has risen, groceries have risen, utilities and medications have risen, and Social Security has not kept pace. It is no wonder that many recipients feel like they are falling further behind despite annual adjustments. Warren also pointed out that 50% of Social Security beneficiaries rely on their benefit for half of their income, and 25% rely on it entirely. These individuals are especially vulnerable to even small shortfalls. If benefits do not keep up with costs, they face difficult choices, sometimes having to choose between food and medicine, rent, and utilities. The $200 monthly increase would make a meaningful difference for these people. It could be life-changing, covering essentials they otherwise might struggle to afford. It is important to clarify, however, that this proposal has not yet become law. The bill has not passed Congress, and no one is currently receiving the $200 increase. The Emergency Social Security Inflation Relief Act, introduced twice in 2025, is intended to provide this boost immediately for the first 6 months of 2026. That means if enacted, beneficiaries would receive $200 extra in January, February, March, April, May, and June, totaling $1,200 for that half-year period. While this would be a welcome relief, it is not a permanent solution. If the increase were removed abruptly after 6 months, many beneficiaries would find themselves suddenly short, having adjusted their spending and relying on the additional funds. There are potential ways to improve the proposal to make it more targeted and effective. Instead of providing the $200 increase to all Social Security recipients, lawmakers could focus on those with the greatest need. Low-income beneficiaries could receive a larger increase, possibly $400, while higher-income recipients might receive less or none. Alternatively, the $200 increase could be extended for a year or more for those in financial hardship. This approach could help ensure that the resources go where they are needed most and could make the proposal more politically feasible by reducing the overall cost. The proposal, as outlined, would be expensive. With approximately 70 million beneficiaries, a $200 monthly increase would cost about $14 billion per month, or $84 billion over 6 months. Warren has suggested funding it through taxation on the wealthiest Americans, closing tax loopholes, and ensuring corporations pay their fair share. These ideas, however, are controversial and would likely face opposition in Congress. Even if the legislation has strong public support, there is no guarantee it will pass both the House and the Senate, and ultimately the president would need to sign it into law. It is critical for beneficiaries to understand this context. While the discussion of a $200 increase is encouraging, there is no certainty it will materialize. Adjusting personal budgets based on the assumption of receiving additional funds could lead to financial strain if the proposal is delayed or blocked. For now, it is a development to watch closely, not a guarantee of immediate relief. Despite these challenges, the conversation itself is important. Social Security benefits have not kept pace with rising costs, and millions of seniors and people with disabilities are struggling. Public discussion and advocacy can influence lawmakers and raise awareness of the issue. This proposal keeps the pressure on Congress to address the inadequacies of current Social Security adjustments. In addition to advocating for benefit increases, it is important for recipients to explore all available options for managing expenses. For those on Medicare, for example, there may be ways to reduce costs, optimize prescription coverage, or adjust healthcare plans. Taking action in these areas can provide immediate relief while waiting to see whether legislative changes are enacted. Returning to the proposal itself, the main points can be summarized as follows. First, the current COLA system is flawed because it is delayed and insufficient to keep pace with real-world inflation. Second, Social Security benefits have lost significant purchasing power over the past 15 years. Third, a substantial portion of beneficiaries rely on Social Security for the majority or entirety of their income. Fourth, the proposed $200 monthly increase is intended to provide immediate relief to these recipients, covering essential needs and helping to restore some financial stability. Finally, while the proposal is ambitious, it faces significant hurdles in Congress and is not yet guaranteed to be enacted. Understanding the implications is crucial. Even if the increase were passed for 6 months, beneficiaries would need to plan carefully for the potential removal of the extra funds after that period. Long-term solutions are needed to ensure Social Security keeps pace with the cost of living over time. Targeted measures that focus on low-income recipients or extend increases over longer periods could provide more effective, lasting support. The proposal also underscores a broader issue: the need to modernize Social Security. Calculations for COLA adjustments, the timeline for implementation, and the impact of inflation on real purchasing power are all areas where reform is needed. Addressing these challenges could prevent the ongoing erosion of benefits and ensure that Social Security continues to serve its essential role in supporting seniors, veterans, and people with disabilities. At this moment, the situation remains uncertain. Advocacy, awareness, and public discussion can help shape the outcome, but recipients should not assume that additional funds are imminent. Monitoring developments in Congress, understanding the mechanisms of benefit calculation, and taking proactive steps to manage personal finances are all important strategies in the current environment. Ultimately, the proposed $200 increase is a recognition of the challenges Social Security beneficiaries face. It is an attempt to provide immediate relief and restore some measure of financial security. Whether it will pass, how it will be funded, and how it will be implemented are still unknowns. For now, it serves as an important reminder that Social Security adjustments are not sufficient for many recipients, and that continued advocacy and attention to this issue are necessary. As the year progresses, it will be essential to watch how lawmakers respond and whether the proposal gains traction. Beneficiaries, advocates, and the general public should stay informed, understand the details of the proposal, and prepare for both potential benefits and continued challenges. Social Security is a lifeline for millions, and any effort to strengthen it can have a profound impact on the financial stability and well-being of seniors and people with disabilities.